Hello, hi there, this is Dr. Vincent Tan, consultant ENT, thyroid, head and neck surgeon from KPJ Klang Specialist Hospital. I believe you have either stumbled upon this site, this page, been sent a link by someone else or including myself. So we are going to talk about something very common, and the title of the talk is to do or not to do it well. That is the question. So, to do what well, in what context? Actually, we are talking about treating allergic rhinitis well. This is an adaptation from a recent talk I gave during a regional ENT conference in August 22. And these are some of the pictures. Okay, we had a good conference, a physical conference after 2 years of the pandemic. So let's move on. Allergic rhinitis, also called as allergic nose, is something very common we see in the ENT setting. And I've written on my webpage on this, on the link that you can see on the screen, or you can scan a QR code. That's one of our old websites. So, like many things in life, nose comes in different shapes, sizes, and form. But do you know that the primary or the main function of the nose is actually breathing? Not even for you to look pretty, look nice, but it is for breathing. Okay, not even to smell. So the main primary function of the nose is actually for breathing. Keep that in mind, because we're going to emphasize on the need of breathing well in our talk. So when you're not breathing well, basically you have a nose block or a nose obstruction. Let me repeat again, primary or main function of the nose is breathing, and therefore allergic rhinitis, or short form AR, is the first major cause of airway obstruction, followed by enlargement or hypertrophy of the tonsils, whether it's in the throat or the back of the nose. So the primary symptoms, the cardinal symptoms of AR is sneezing, runny nose, nose block, nose itch. As you can see in the video here, right, you can see a wet nose with very blocked right nostril seen through an endoscope. So there's hardly any space normally between the turbinate and the septum. There is some space for the patient to breathe. And this is the same patient on the left side of the nose. Therefore, you can see again the same wet look of the nose, and there's hardly any space for air to pass through. Therefore, the space between the side wall called turbinate and the septum is really, really narrowed. So can you imagine having this on both nostrils of yours, and how are you going to breathe? And some patients will present with snoring as well. Therefore, because the nose is narrowed, therefore air will have to travel in an abnormal manner, therefore it produces sound as air travels through the nose. In some patients, it can be associated with enlarged adenoids. Adenoids is a group of lymphatic tissue behind the nose. Besides that, what you're seeing here is called turbinates, or more commonly called inferior turbinates, more accurately called inferior turbinates. Alright, normally it's not so big. When it's enlarged, it blocks the whole passageway, therefore you have reduced airflow through the nose. And there are also further studies to investigate the causes and alterations of the oral breathing in children, and they have concluded that allergic rhinitis was among the most frequent causes of oral breathing in children. And AR is also the most common chronic disease worldwide. So there you have it. So AR is indeed very common, and also a common disease that we see in our clinic. So there's more than meets the eye when it comes to treating patients with AR. Of course, many times for you all as patients, you want immediate relief for the symptoms that you come to see us with. That's why you come to clinic with certain symptoms, namely sneezing, running nose, obstruction of the nose, snoring, or even nasal itch. But the undercurrent, the underlying issue is there are also long-term proven complications if you don't treat it well. Therefore, after your symptoms have been treated, it's not just a matter of immediately stopping your medication. You've got to remember that. I know many times patients come to us just to get the symptoms relief, and they think that's it, it's done. Do not need to continue treatment anymore. Why would I need to continue seeing the doctor once I'm well? Why do I need to continue to pay money for the medication once I'm well? But you must be aware, hence this effort to make this video to make you all aware because sometimes we understand in the clinic, if it's busy, we are not able to share many more things that we would like you to know. Therefore, this video is also given to you, a link of this video is given to you as an extension for you to understand a bit better what you can foresee in the near future if you do not treat this AR well. As you can see here, the complications has been laid out to you in 5 different categories. We'll go through one at a time. Number 1, let's talk about infection risk. This is also commonly seen. Okay, I did mention the adenoids, which is the gland behind the nose, and tonsil, which a lot of people are aware of. That means that little two swelling at the back of your throat, okay, being enlarged. This is something common that we see besides the terminate of the nose that is swollen. But do you know that there are also many other possible complications that can arise if you don't treat your allergic rhinitis well? Of course, we'll go through some pictures here. So if you have had the chance to have a scope of your nose done, whether for you or your children, you get to see, or at least Dr. Vincent will have told you, that sometimes there can be enlarged adenoids. This is the gland that sits behind the nose. It's at the junction of the nose and the throat. And there is also the opening, we call it the eustachian tube opening, that connects your nose to your ear. So you can see that this little opening is just to the side of these enlarged adenoids. But remember that the adenoids will continue to grow and grow, and it can eventually block off this opening, and therefore it will lead on to ear complications. As in this case, you can see that this adenoid is already enlarged and there's mucus overlying. Commonly, this is due to infection. And here in this next picture, you can even see there's also enlarged adenoids together with some pus on it, the yellow the mucus or the yellow discharge on top of this. When it affects the ear, you can also see that the eardrum is red. Over here, we call it acute otitis media. Or sometimes if it's completely blocked, the next step that will happen is you're going to develop fluid behind the eardrum. And eardrum is the front part of the middle ear compartment. Middle ear is just a space that connects the nose to your ear. So normally it's just filled with air. But when you have obstruction of this eustachian tube, the air will be taken over and replaced by fluid, which can also be infected and become yellowish sometimes. Okay, and in the nose itself, if you do not treat your AR well, you also stand a higher chance of having a sinus infection. You can see here this yellowish mucus, the pus that will flow up from your sinus opening into the back of the throat. Therefore, some people will come with coughing, although the nose may be what they think is well, but they may also have coughing because this post-nasal drip, this yellowish mucus, is the one that keeps running down the throat and irritate the throat, making the patient cough. And I told you earlier on, some of you come actually with enlarged tonsils, but sometimes enlarged tonsils are also having AR as one of the possible causes. Of course, the other common cause is patient having unhealthy tonsil. The tonsil itself is a source of infection without AR. But remember that in many cases, if you don't treat your AR well, the mucus that backflows to your throat can also goes down your throat and irritate your tonsils along the way. So you can see ear, nose and throat, okay, they are joined in many ways, where the nose from here goes down the throat, and from your back portion of your junction of your nose to your throat, there's also the eustachian tube opening we talk about. The nose is joined also to the different sinuses. Okay, we have about 10 sinuses in most patients, 5 on each side, that are spaces in the facial skeleton that can also get blocked if, for example, you have bad allergic rhinitis. So this is another cross section that you can see how the nose communicates with the throat to the ear and down the rest of your throat, and from here downwards to your lungs. So any problems from the nose can also cause eventual problems to your ear and your throat as well. Let's talk about mouth breathing effects. Dry mouth reduces the beneficial effects of saliva and encourages the growth of plaque biofilm. Think of biofilm as a colony of microorganisms or germs in the mouth. Plaque is the thickening that happens as a result of the build-up of this biofilm as well. So mouth breathing will negatively affect the organism or the microorganism of the mouth and the throat area, especially the front part, the upper segment. Thereby, with this, we are more susceptible to oral infection, be it gingivitis, which also means inflammation or swelling of the gums, or plaque. For those who are more scientifically inclined, who wishes to know more, who wishes to look up the actual scientific journals, here the references is provided. This is just one of the many examples of how organisms can change in the mouth as a result of mouth breathing. And the pictures here tells of the changes, the teeth that you can see, the overriding of the upper teeth, the unhealthy looking teeth, a crowded kind of appearance of the teeth, not to mention plaque formation as well over this dental region. Dental plaque formation and gingival inflammation are the earliest and the most common indicators of periodontal disease in children and adolescents. Not to mention, it can also lead on to foul smell in the mouth called halitosis. Further examples of atypical microorganism growth causing infection of the gum associated with chronic mouth breathing. So, as mentioned, we can get all these abnormal changes or unhealthy changes in the oral cavity due to chronic mouth breathing. As you know, our oral cavity or mouth is not clean. There are germs residing inside our oral cavity, but they live harmoniously. They do not cause disease until the whole ecosystem is upset, is affected due to some other unhealthy changes. So, in this case, is an example where, because of the chronic enlargement of the adenoids, which we talked about just now, chronic enlargement of the adenoids leads on to nose block, leads on to mouth breathing, and thereby affecting the oral hygiene of the patient. The patient eventually needed removal of the adenoid gland besides the dental treatment. There you go. So, now let's move on to the second complication. So, the second one refers to facial changes, including dental, developmental abnormal changes, or anomalies. Since as far back as 1872, we know of some changes that can appear, and this has been coined as adenoid facies. It's also called the long face syndrome due to chronic nasal airway obstruction. So since far back then, we know there are changes that are brought about by this, and it's also called quote-unquote dumb face, all right, open mouth. As a result of this, patients actually using the mouth to breathe because the nose is chronically blocked. There's presence of dental crowding, there's presence of high arch palate. Okay, I will have videos to show you on this, do not worry. And also we mentioned that there's prominent crooked upper teeth. Basically the alignment of the teeth are not good, and as a result also of this chronic nose block, patient gets the elongated face. We also already know that AR has some hallmark features. There are more pictures of this in the book I've written, namely allergic shyness, meaning to say there's like black rings or black circles around the eyes. Denny-Morgan lines refer to some of the lines at the lower lid, and allergic salic crease in some patients as a result of pushing their nose up when they rub their nose. So there is a transverse or horizontal crease across the nose. It's not present here, but in some patients, yes, it will be present. Let's look at this video. This video is not mine, but it is beautifully produced to help you understand. So copyright belongs to its rightful owners.
The normal or physiological way of breathing is through your nose. Breathing through the nose permits to purify the air by the structures inside the nasal cavity. In that way, the air entering into your naso- and oropharynx, your throat, is not going to heavily affect the lymphoid tissue in the adenoids and tonsils, which is the last barrier to catch harmful particles in the air before it reaches your lungs. Besides clearing the air from harmful particles, nasal breathing stimulates the production of gases and substances in the nose, which are going to facilitate the entrance of the air in the lungs and prevent infection in your respiratory system. Mouth breathing allows the air to pass directly into your throat, where the adenoids and tonsils are located. In that way, the air entering into your body through your mouth has not previously been purified, and the lymphoid tissue in the adenoids and tonsils become the first defensive barrier against the harmful particles contained in the air. As a consequence, that lymphoid tissue overgrows, occupying a large volume of your throat. That makes more difficult for the nasal breathing, and you make a habit of breathing through your mouth. In order to breathe through your mouth, your lower jaw has to come down, as well as your tongue has to rest on the floor of your mouth. Breathing through the nose is the correct way, and so the tongue is able to rest on your palate, stimulating a normal growth and development of your upper jaw. Conversely, when you breathe through your mouth, your tongue has to descend and protrude. At the same time, the pressure of your cheeks increases, pushing the upper jaw inwards. So the growth and development of your upper jaw is negatively affected, resulting in a narrow and high palate. The upper dental arch acquires a V shape instead of being a rounded dental arch. Therefore, your teeth do not have space to properly align. This also produces an incorrect swallowing function. Every time you swallow, between 1,600 to 2,400 times per day, the tongue positions low, staying away from your palate. That forces the tip of your tongue to position between your upper and lower front teeth. That pushes your front teeth to show out of your mouth, and your tongue resting on the floor of your mouth, with the tip of the tongue between your front teeth. That is called an open bite, as your upper and lower front teeth do not touch when you close your mouth. All those dysfunctions, mouth breathing, incorrect tongue posture, open mouth, and incorrect swallowing are going to continue affecting the growth and development of your upper and lower jaws. And as a consequence, there is less room for your teeth and they become crooked. Remember, the nose is for breathing and the mouth is for eating. Breathing through your nose and keeping your mouth closed with your lips together is going to help your upper and lower jaws to grow and develop better. But more importantly, it makes you healthier.
By the tongue.
And there is
A
another
normal
video.
top jaw should look like this. The arch is wide and U-shaped, formed by the tongue as it rests in the roof of the mouth. There, it counteracts the pressure of the cheeks, which would otherwise push the upper arch of the jaw inward. However, if a child sucks their thumb or habitually breathes through their mouth, then the tongue drops from the roof of the mouth and the upper arch of the jaw gets pushed in to create a less attractive, longer, and narrower face with crooked teeth. In addition, when a child habitually breathes through his or her mouth, the top and lower jaws become underdeveloped and set back from their ideal position. This negatively affects the appearance of the face, making the nose look larger and, more importantly, reducing airway size.
So there you go. These two different videos, I believe, helps to understand the changes that we see in the patients who have long chronic nose block and breathing through the mouth. The next slide will illustrate in greater details with all the scientific terms for those who are interested how one change leads to the other. So this is especially important in patients with allergic nose in children before the facial skeleton is fully matured. Therefore, it is still subject to all these different changes, the different pressures, the different forces working on the muscles of the mouth or the nose or the lips that affects the whole development before it fully matures. So you can look through this slide, try and understand for those who are inclined to know the medical terms and how it is one change leading to the other. So there you go. So these are further photos that you can see of the dental abnormalities, and these are in real patients. These are pictures taken from medical journals that illustrate what has happened due to neglected and poor care, especially where the nose block is concerned, and how it has led on to many preventable instances of poor oral hygiene, poor oral development. These are further pictures. You can look up the references if you're keen, but Remember, these are preventable. All these are largely preventable had it been treated for the nose treatment earlier. To further illustrate the nose changes, as we have heard earlier, the palate can be pushed inwards. Therefore, the hard palate is being pushed from a normal position up to a higher position. Assuming that the septum, the nasal septum, which is the middle partition of the nose that separates the nostril into the right and the left into equal spaces, but because of this upward movement of the palate, the septum has been squashed. Therefore, to accommodate this septum in a shorter or a lower space, it will have to bend. When it bends, it narrows this right side and create an unequal nasal passageway. So this will lead on to what you see in the pictures here. This is another example of a real patient of mine, illustrating what we have read about, what we have talked about, and the video for which you have seen. You can see this is a palate, hard palate that is higher than normal. It's a much curved palate. So when we examine the patient, when we put in the finger, we can feel the palate is actually higher. It's much more curved upwards than what it should be. And you can also see the brownish stain on the teeth. You can see how the teeth are jagged. The alignment of the teeth is not good. Basically, the poor dental alignment, there's malocclusion, there's crowding on the teeth of a patient. And to give you a background, this patient has had nose block for many years that has gone on untreated. So he's had recent surgery to remove the adenoids that has completely obstructed the nose with no space whatsoever for the patient to breathe. So therefore, you can see over the years it has led on to such changes. Also, you can see the brownish stain of the teeth on the teeth, also further adding on to the poor oral hygiene of the patient. So there's poor dentition, there's poor alignment of the teeth. So he has been referred to the dentist for further care. Okay, we have spoken about complications 1, which is an infection risk in the whole ENT system. We have spoken about complications 2, which is facial changes, dental changes that can occur as a result of chronic nose block. Let's talk about complication number 3. It stands for obstructive sleep apnea, or OSA. So OSA has a peak incidence between 2 to 8 years old. OSA means when you sleep, you are not breathing, and therefore there's a stoppage of breathing for 10 seconds or more. That refers to obstructive sleep apnea as a result of blockage from your nose airway system down to your throat, your neck, the lower part of your neck, your throat. So that constitutes OSA, obstructive sleep apnea. Even children can have that. The children's symptom may not be so clear-cut as in adults. There can be unexplained headaches, morning headaches, daytime sleepiness, although some can be hyperactive. There can be cognitive, means of mental processing, intelligence level, for example, and behavioral issues that can arise. Over a long period of time, they can have growth failure, meaning to say they are not able to achieve the full potential of their growth. Of course, this one is much worse complications as a result of the cardiovascular system being affected. Alright, let's not wait until this happens, and this is more for the medical personnel that says in a non-syndromic patient, child with no apparent other medical problems, with snoring, it is reasonable to proceed to remove the adenoids or tonsils, whichever is enlarged, without a prior sleep study done. Because in adults, sometimes we do sleep study to understand the sleep problems further. Alright, for more details, these are proven, studied evidence to say how allergic rhinitis can lead on to obstructive sleep apnea and how the two are related. So in AR, we have an increase in production of some of these inflammatory mediators, that means biochemical changes in the body that eventually leads to sleep disturbance, poor quality of sleep. Okay, and because of the nature of the AR, it leads on to nose block, therefore cause mouth bleeding and the changes that we mentioned about. And these changes also helps to potentiate certain changes in the oral airway that makes it narrower, makes the patient harder to sleep. Yeah, so both are interrelated, and how this can become a vicious cycle for the patient. And there are also multiple journal articles out there in the medical world that says that confirms how allergic rhinitis is related to sleep study. So in summary, AR was also associated with higher risk of nocturnal dysfunction, including insomnia, nocturnal enuresis, restless sleep, sleep disordered breathing, obstructive sleep apnea, and snoring. Meta-analysis for adjusted odds ratio also showed that AR was associated with daytime dysfunction, including difficulty waking up, daytime sleepiness, morning headaches, and the use of sleep medication. Okay, let's move on. Let's talk about another condition that is very much related to AR, bronchial asthma. I think most of us know what asthma is like. But for patients who have allergic rhinitis, they stand a high chance of developing AR in the future. That is why we have to be serious about treating AR. And this is based on multiple medical evidences. For example, this is one of the biggest studies and also one of the longest studies that look at the ratio of patients who eventually became asthmatic. They studied the risk of patients, in this case they are freshman college students based in the US, over a period of 23 years. How they did that? Well, they have questionnaire for the patients, they did skin prick tests on enrollment for the patients, and they follow up over a period of 23 years. Imagine 23 years is a long time. And the summary, okay, the gist of the conclusion is frequency of asthma and AR continue to grow as the patients become older. AR and positive allergy skin tests are significant risk factors for developing new asthma. Individuals with either this diagnosis are about 3 times more likely to develop asthma than those who are negative controls. Positive allergy skin tested patients or students have 2.3 times the risk of developing hay fever than those who don't test positive. Asthma correlates to allergies in that 61% of asthmatic subjects have positive skin allergy tests. Remember, this is a study done over a long period of time. So the longer the study, the more reflective it is of the true nature of the disease. And you have a large group of numbers of students or subjects here, close to 2,000. So this gives a very strong evidence as to the risk of AR developing into asthma in the future. Okay, next we have another paper that look at the other non-atopic. Atopic in medical term means allergic, but there's another group where the nose can be runny, they can have frequent runny nose, sneezing, or all these nasal symptoms, but not due to allergic symptoms. It could be changes like temperature change, weather change, some are to smells, environmental pollution. In a medical from a medical point of view, this does not constitute allergy. It could be a response, and a non-allergic response, although at the end of the day it may still produce some symptoms similar to an allergic rhinitis symptom. So this is the group we call non-atopic rhinitis. So even in this group, rhinitis increased the risk of development of asthma by about 3 times, yeah, and by about 5 times among patients in the highest IgE tertile. IgE is the antibody test that we do to study the risk of allergy. Okay, tertile definition has been given there. This is a statistical term. Patient with rhinitis with persistent and severe nasal symptoms and a personal history of physician-confirmed sinusitis has an additional risk of asthma development. So the conclusion is rhinitis alone is a significant risk factor for adult onset asthma in both the atopic and the non-atopic subject. This is published in the year 2002, followed up over a period of 9 to 11 years, which is significantly long, and the study subject group is also big. Next, we are trying to understand as well how is it that the patient with no allergic rhinitis, although having a rhinitis symptom, can also be associated with asthma. So the reason has been given at the bottom here. Alright, there are three mechanisms or three theories as to why patients with non-atopic rhinitis can also have issues with the lungs that brings on asthma. I will not go into this as it's very technical for the layman, but those who wish to read can read up a bit more on this. So there is association between rhinitis and asthma that appears stronger in the group with a higher level of total IgE than in groups with intermediate or low IgE levels. So now, present day, we know of this relationship between AR and bronchial asthma. So AR is associated with bronchial hyperresponsiveness, meaning to say the bronchus, meaning the airway in the lungs itself, is responsive, even though patients may not have an overt, may not have an obvious asthmatic symptoms. By and large, we can take it as 40% of AR patients have asthma, and as much as 94% of allergic asthma patients have AR. That's the concept of what we call the one airway disease or the united airway disease. Meaning to say, if you control the nose symptoms well, you can control your asthmatic symptoms well. Yeah. So does treatment makes a difference? Yes, definitely based on the same group of subject of study in this paper that we quoted earlier, where they were followed for 23 years. Yes, the answer is yes. So among asthmatic patients with AR, improvement of asthma was associated with resolution of the nasal symptoms of AR. A worsening of asthma is also associated with persistence of AR symptoms. So, like mentioned, this is a big study over a long period of time. Yeah, so it definitely makes sense that the results that show up from this study. Okay, we are down to our last issue, social issues. While previously we talked about real physical health conditions, the final one is not as serious, but however, it still takes away the enjoyment of your daily living. Social issues, what are they? Okay, you have nose block, you can't sleep well, you get headache, or if you have runny nose, can you imagine working on very important task at hand and you keep having to blow your nose, unblock your nose, so it becomes something that affects your work performance. You can get headache sometimes when you wake up the next day, and affects your social communications with the other people around you. Okay, it decreases your work performance, not to mention it's also a financial burden for you. You know, the cost of medication, the cost of consultation with the medical providers, also a quality of life issue because it affects your smell and your taste. Your food no longer tastes as good. Social embarrassment, yes, when you have to carry along your tissue papers, when you have to always blow your nose in front of others, especially in the era of COVID, with all this multiple viral infection, COVID, influenza, RSV, hand, foot and mouth disease, definitely it can be an issue in your daily social interaction. And not to mention some people who have also chronic rhinosinusitis, CRS, can also have more or less the same symptoms. So it is a social issue. So there is no reason not to treat AR well. There are many international guidelines. It is common enough among the patients in the community to embark on it, to treat it seriously. And the good news is good treatment really does make a difference. You don't have to suffer. There are many guidelines, ARIA guidelines, and so many. Okay, these are just examples for medical providers. We get updates on this from time to time. We read up on this from time to time to know what's the latest in how to treat the patient well. So as conclusion, all right, just like more than meets the eye, the one we talked about earlier on. So yes, it's more than meets the eye for any kind of AR symptoms. You all go to a doctor for certain symptoms to be cured, but it's the responsibility of the medical solution providers that they look into all these other aspects that you know well. Hence, this extension of this explanation in this video I have given you, because I would like you to know that AR can have other future problems that may arise. Therefore, do not just treat the symptoms and be done with it and think that it's done. Please spend a bit more time to understand the whole disease process. It's indeed whatever we do is to benefit you, because early intervention relieves current severity of symptoms and reduces potential future complications. Now that you know there are potential complications, let's hope you are serious in taking the medications as well. For those who need, or for those who are on surveillance, yes, please watch out for symptoms that may need you to return to your doctors to get it sorted out again. Alright, so as doctors, we also have the responsibilities to manage this problem with other relevant specialties, like what I told you, the dental people early on. Okay, therefore it's also upon us to keep educating, to keep upgrading our knowledge, so that we can pass on our knowledge to help you. And now with social media, for example, like this video, we are able to share it more effectively with you. And once you as a patient understand this, you are also able to share the same knowledge with other fellow patients as well, or your family members, so everyone will benefit. So for patients, it's indeed important to be compliant. That means to take the medication, to take the advice as given seriously. So with that, I'd like to thank you very much for listening. Now you understand AR is more than meets the eye. So thank you very much for your kind attention. So indeed, with this new knowledge that you possess now, we hope you have a better treatment outcome. You will indeed benefit from this test, and we wish you all the best.